So I'm gonna knock my door. Knock. Hey there, Miss Baker. My name's Kylie. I'll be your nurse today, okay? I'm just gonna take a quick, I'm gonna wash my hands real fast, okay? So as I'm washing my hands, I do want to make sure that I look at my room, make sure that it's safe for my patient. There's nothing laying on the floor. I'm going to take a quick look at her appearance, see her facial expression, see if she's grimacing or anything. I'm going to look and make sure she doesn't have like a Foley or is up to oxygen. Wash my hands. My hands are all washed. So what brought you in today? Nausea and some stomach issues and some pain. Okay. You've had it for the last 3 days? Okay, hon. Well, I'm going to take a quick assessment, all right? Can you tell me your name and date of birth? And while she does that, I'm going to look at her bracelet to make sure her information is correct. So she tells me her name and date of birth, which is correct. Can you tell me where you're at? Good. And today's date? Excellent. Have you sit up real fast. So I'm going to have you turn your head towards your left. Okay. And toward your right. Good. No JVDs present. All right. I'm going to take a feel of her skin. Her skin is pink, cool, and dry. No edema on her arms or hands. Just going to feel your pulses. So for her pulses are present bilaterally, even and strong. Good. I'll have you squeeze my fingers. Excellent. And can you pull towards you? Good. And push. Good. And check her trigger real fast. Trigger is good. I'm going to check her capillaries on her hands, which are good. Both are less than 3 seconds. Any numbing or tingling in your fingers? Nope. Can you wiggle them for me? Excellent. All right. So I'm going to go ahead and grab her vitals at this time. Her vitals are good. Her blood pressure is 130/72, pulse is 80, respirations are 16, oxygen was 96% on room air, temp 98.3. Any pain? So she is saying she's having some pain on her right upper side of her belly. Okay. I'm going to go ahead and listen to your lungs real fast. Go ahead and listen to her lungs. Okay. And listen to her front. While I'm here, I'm going to go ahead and listen to her apical pulse. Her lungs were nice and clear. Apical pulse is present, regular, strong. All right. Do you have any cough? No coughing? Okay. So I have this. I'm going to go ahead and listen to her belly. I'm going to start her right lower quadrant. And her up. And go to her left. And go down. Good. So her bowels are hyperactive. I'm going to go ahead and feel your belly. Any tenderness? Oh, good. Tenderness right here. Tenderness up here. Okay. She had already told me she was having some pain, so that is tender to touch on her right upper quadrant. Go to your left side. Any pain? Nothing? Okay. While your shirt's up, I'm going to look for any drainage, any incision. Nothing. Skin's good. Nothing out of the ordinary. So I'm going to head and feel her legs. Her legs are also nice and cool and dry. No edemas present. I'm going to go ahead and feel her for repeated pulses. Okay, repeated pulses are present, strong and even. Okay, I'm going to check her capillary refills, which are good, less than 3. I'm going to have you push down like a gas pedal. Good, and pull up. Excellent. And can you wiggle your toes? Good. Any numbing or tingling when you do that? None? Okay. So she is So I would document her assessment in the correct format, time and date. She's telling me that she is nauseous. She ends up vomiting. She had 300 milliliters worth of coffee ground MS. So I would definitely document that. Notify the healthcare provider, which he did order some Zofran. I'm gonna make sure my patient's safe, call light and reach, wash my hands before I leave, and I'm going to go grab her Zofran. Alright, knock my door. Knock, knock. Okay there, Miss Baker. It's me again. So the doctor did order you some Zofran, which will help with the nausea and hopefully the vomiting too, okay? So I'm going to set this down. I'm going to wash my hands. So I let Miss Baker know what I'm giving, what it's for. The doctor did order 4 milligrams of Zofran. So I'm just going to have her state her name and date of birth. Can you tell me your name and date of birth? Which is correct. I'm going to check my doctor's orders. I need 4 milligrams of Zofran. So I have my syringe for my medication. I have normal saline for my flush. And I have Zofran. So I'm going to check my order, make sure I have the right medication. I'm going to be giving it through her IV. So I'm going to, like I said, wash my hands. I put some gloves on. So I have my Zofran. So I'm going to clean off my top. So I got my top clean. Then take my syringe for my Zofran. So I'm going to pull up my medication. And I need to remember with Zofran, I need to administer it slow. So I got my 1 milliliter of Zofran. So I'm going to administer this over 2 minutes. I have my alcohol swab. I'm clean off my adapter. I'm going to undo my clip so I can administer medication. I have my normal saline. I'm going to flush with at least a minimum of 2 milliliters of my normal saline. So I'm going to flush that with 2. And then I have my medication, which I'm going to administer slowly over 2 minutes. I'm going to let her know to let me know if she gets a headache, feels dizzy or drowsy, and that this medication can cause constipation, diarrhea, okay? So I administer my Zofran, and I'm going to flush with another 2 milliliters of normal saline or more. And when I flush after medication, I do want to flush slowly since I do have medication in this line, so I don't want to flush it too fast. So, okay, so I give her another 2 milliliters. Clamp this. IV's clamp. I would make sure that I put a cap on the end of that. I would document the time and date, my medication, how many milliliters I flushed her IV with before and after. Okay, so I set her there. Wash my hands before I leave. Make sure she is safe before I leave too. And then I'm going to knock on the door. Okay there, Miss Baker. How are you feeling? Good. Well, it's the end of my shift, so I'm going to give Michael a report on you, okay? Alright, so this is Miss Baker. She's a 54-year-old female who came into the ED on 4/16 complaining of nausea and severe epigastric pain. Say she's had this for the last 3 days before coming in. She does have a history of osteoarthritis. She takes ibuprofen 400 milligrams 3 to 4 times a day. She says she's been taking this for the last several months since her osteoarthritis has gotten worse. Upon her assessment, her vitals were good, 80 of 16, 130 of 72, and 96. Bowels were hyperactive with tenderness in her right upper quadrant. After her assessment, she did have 300 mLs of MS, that was a coffee ground color. I did administer 4 milligrams of Zofran via her IV, but she does have a 20 gauge in her right forearm, or in her left forearm. Her lab showed her H&H were low, so the doctor did order 2 RBCs. We put an NG to low section wall. Later we found the canister that was filled with frank red blood. Her BP was 96/60. Like I said, so we ordered some blood for her. She got that. She did go down to the GI lab stat. They did a EGD. They found 2 slow bleeding ulcers, which they cauterized. And then they also found 1 arterial bleed that they repaired as well. She returned back to the floor at 19:45. Pain has been managed. We have just been observing her. Do you have any questions? Good. And Miss Baker, do you have any questions? Well, I'll be back in the morning. I hope you feel better, okay?